Assalamualaikum students. Today the topic under discussion is a disease especially of the equines known as glanders. Glander is a contagious, acute or chronic, usually fatal disease of Equidae caused by Burkholderia mallei and a pathoadaptive clone derived from Burkholderia pseudomallei. It is characterized by a serial development of nodules in the upper respiratory tract, lungs, and skin. And in Felidae and other species are also susceptible, and infections are usually fatal. The organism is infectious for people with a 95% fatality rate in untreated septicemia cases, and is therefore considered a potential bioterrorism agent. Glander is one of the oldest disease known and once was prevalent worldwide. It has now been eradicated and effectively controlled in many countries, including the USA. In recent years, the disease has been reported in the Middle East, Pakistan, India, Mongolia, China, South America, Africa, and some European countries, including Russia. Coming towards the etiology of glanders, then Burkholderia mallei, a clonal gram-negative facultative intracellular obligate pathogen, is present in nasal exudate and discharges from ulcerated skin. Glanders is commonly contracted by ingesting food or water contaminated with nasal discharges of the carrier animals, and contact with the harness component, ingestion of the meat from affected horses. The organism is susceptible to heat, light, and disinfectants. Survival in contaminated area is limited to 1 to 2 months. Humid, wet conditions favor survival, and polysaccharide capsule is an important virulence factor and enhances the survival in the environment. Coming toward the clinical findings, after an incubation period of 3 days to 2 weeks, animal acutely affected by glanders usually have septicemia, high fever, which ranges 106 Fahrenheit degree, and weight loss, a thick mucopurulent yellowish nasal discharge, and other respiratory signs. Death occurs within few days. The chronic disease is common in horses and is seen as a debilitating condition with nodular or ulcerative lesions of the skin and internal nares. Infected animals may live for years and continue to disseminate the organism. In some, the infection may be latent and persist for long periods. Donkey and mules are more severely affected than horses. Then it has three different forms. Number one is the nasal form of glandar have nodules develop in the mucosa of the nasal septum and lower parts of the turbinates. The nodules degenerate into deep ulcers with raised irregular borders, characteristic star-shaped cicatrices remain after the ulcers heal. In the early stage, the submaxillary lymph nodes are enlarged and edematous and later become adherent to the skin or deeper tissues. Then comes the pulmonary forms of glanders, the small tubercle-like nodules which have caseous or calcified centers surrounded by inflammatory zones are found in the lungs. If the disease process is extensive, consolidation of the lung tissue and pneumonia may be present. The nodules tend to break down and may discharge their contents into the bronchioles, resulting in extension of the infection to the upper respiratory tract. Then we have a cutaneous form of glanders, also known as farsi, and the nodules appear along the course of the lymph node vessels, particularly of the extremities. These nodules degenerate and form ulcers that discharge a highly infectious sticky pus. The liver and spleen also may show typical nodular lesions. Histologically, there may be vasculitis and infiltration of degenerating inflammatory cells. Coming toward the diagnosis, suspected based on cutaneous nodules exudating honey like discharge or nasal discharge with ulcers on nasal mucosa. And it can be confirmed by complement fixation test or culture and also PCR. A test for delayed hypersensitivity is performed by the intrapalpebral inoculation of mallei, a secreted glycoprotein of Burkholderia mallei found in culture supernatant. Infected hypersensitivity horses develop a purulent conjunctivitis within 24 hours and swelling of the eyelid. Coming toward the prevention and treatment, the detection and elimination of confirmed cases is recommended. Treatment is contraindicated. There is no vaccine for glanders. Protective immunity involves T cell responses elicited by live attenuated bacteria. Prevention and control of glandar depend on early detection and elimination of affected animals, as well as complete quarantine and rigorous disinfection of the area. This is all about the glanders. Thank you so much.